and we will collect those questions throughout the webinar to address during the Q&A period. Closed captioning is also available for today's session, and thank you to our captioner, Mary Kay. To open closed captioning on your window, please press Control F8. An additional window will open where you can resize and format the captioning as you wish, and you may also resize the captioning window so you can see both that and the PowerPoint presentation at the same time. If you are having difficulty with Blackboard functioning, please contact Blackboard Technical Assistance. The phone number is 877-382-2293. I'm now going to turn it over to our NADTC co-director, Virginia Dyes, for a quick introduction to our center before we begin the presentation.
Good afternoon, everyone. Welcome to our first NADTC webinar. We're very excited to have you on the phone with us. Just a couple of words about the NADTC, the National Aging and Disability Transportation Center. Our focus is primarily on working with communities and states around the country in helping them address accessibility issues that particularly impact older adults, people with disabilities of all ages, and their caregivers. Those are our primary target audiences. We have a number of communication vehicles. We hope you've already looked at our website. We certainly invite you to check out our Facebook or Twitter accounts, as well as our LinkedIn site. And please definitely sign up for our e-alerts that come at least a couple of times a month. We are a partnership. The NADTC is a partnership between the National Association of Area Agencies on Aging and the Easter Seals, and we're funded by the Federal Transit Administration. We will, hopefully, in the next month or so, be making an announcement about an opportunity for grant funding. We also have an upcoming course on 5310, which is part of our mission to provide education and support to communities on the Section 5310 program. And that course will be beginning late this month. So please stay tuned for those opportunities to interact with us. And now I'm going to turn it back to Eileen.
Great. Thank you so much, Virginia. So I'm going to make a few introductory remarks, and then I'm going to turn it over to our speakers today, Mary Blumberg, Program Manager of Strategic Planning and Development at the Area Agency on Aging at Atlanta Regional Commission, and Patty Zarowick, Aging and Disability Resource Connection Information Counselor, also from the Atlanta Regional Commission. And the three of us have had some interesting conversations as we've prepared for this webinar, and I really do hope that those conversations will continue with you all who have joined us today throughout this session. And so please don't forget to submit your questions through the chat box, either directly to NADTC staff or at the end of the session when we open up for open chat. So a quick introduction to the session. In the last few months, NADTC has received a number of emails and phone calls on our toll-free line from hospital social workers, case managers, housing coordinators, and other community social service workers who are seeking transportation resources for their clients. And what we realized was that more information was needed on how to connect and partner with transportation professionals in your community. So this webinar is just the first step in our efforts to develop some material to address these calls. Our second step will be the release of an information brief publication that will be released online, and that will be intended to walk you through some of the steps needed to navigate transportation in your community. And how to find out about some community resources and connect with the right people. That brief should be released within the next coming weeks, and as Virginia said, if you sign up for our newsletter, you'll be in the know of all of our updates. So a few of the things we hope you take away from this session are an understanding of how transportation can impact individuals in receiving timely and necessary support services, some ideas and best practices from the ARC, and some information and resources for you to engage with transportation providers in your community. So uncovering how to navigate community transportation resources can help service providers better understand the reasons for and hopefully prevent some late arrivals, missed appointments, follow-throughs with referrals, or the inability to maintain employment. So if the community at large is familiar with transportation options, it enhances dialogue with the consumer and their caregivers, but also with transportation providers to help determine what the best options might be to match an individual's unique needs. So when we talk about transportation in communities, we like to refer to it as a family of transportation options. And this family of options is used to meet the mobility needs of seniors and people with disabilities. One size does not fit all, and the solutions are unique to each community. So this list you see on the screen reflects flexible and consumer-focused transportation services. You'll see it includes private vehicle options, public transportation, volunteer solutions, accessible vehicles, reduced fares, dial ride, and more. And many communities are offering a combination of the modes listed, but the challenge that we think you might face is how to find out about what is offered. Chances are, though, that there is a program or resource in your community that can offer assistance and help your clients find the rides they need. So a couple of the terms you might hear us referring to throughout this presentation: information referral and assistance. Information referral providers connect people with resources that span topics from transportation, but also housing, and home and community services, healthcare, and more. And INR can be provided by nonprofits, area agencies on aging, aging and disability resource centers, faith-based organizations, or government agencies. And these service providers are usually the quickest and most reliable source for connecting people with the services that they need. So transportation INR can sometimes occur through one-call, one-click centers, and we'll hear a little bit about a one-click service that the ARC runs a little bit later. So this is when consumers have a single point of contact to learn about information that's available and receive assistance with access to those services. Travel training refers to the instruction of skills necessary to travel safely and independently on available transportation options. And lastly, mobility management, which can both refer to one-on-one counseling or group counseling on transportation options, but also to a broader set of activities that's done within the community to help create partnerships and coordination among the various organizations that may offer transportation. So we're now going to turn it over to Mary and Patty, and I just want to do a quick introduction so you can hear about some of their background before they provide their presentation to you. So Mary Blumberg is the Program Manager for Strategic Planning and Development at the Atlanta Regional Commission, Aging and Health Resources Division. Mary is responsible for overseeing activities within ARC's Lifelong Community Initiative, which promotes diverse housing and transportation options, opportunities for healthy living, and convenient access to basic services. She oversees a range of transportation programs for older adults, persons with disabilities, and low income, including FTA's Section 5310, the DeKalb County Coordinated Transportation System, and Title III Older American Act Transportation Services. She has both a BS and MS from Louisiana State University in nutrition, and she's a registered dietitian. And after Mary, we'll hear from Patty Zarowitz, and Patty began working at the ARC as a CARES counselor and then as the Aging and Disability Resource Center counselor in 2006. During her 10 years of service as an ADRC counselor, she has provided telephone counseling and referrals of community resources to seniors and individuals with disabilities. She's a certified options counselor, and she's certified information and referral specialist for aging and disability. So Mary and Patty, I think we'll turn the controls over to you and just let us know if you've accepted.
Yes, thank you, Arlene. We are delighted to be with you this afternoon and hope that we can share just a little bit of what we're doing in Atlanta. First, I wanted to tell you a little bit about what the Atlanta Regional Commission is, or ARC. We are both a regional planning and intergovernmental coordination agency, and we serve a 10-county area, and we have about 4.2 million people we serve. And we're both, these are federal designations we have, but we're both a metropolitan planning organization, MPO, and a AAA, an Area Agency on Aging. And that just means as an MPO, we are responsible for creating all of the transportation plans for the region and funding and distributing that funding for infrastructure. But we also, as an Area Agency on Aging, are directly involved in providing the services for people who need it right now. So we both plan and we provide services. We administer a variety of different programs here that deal with transportation. This is just some of our many different funding streams. And one thing to know about this is that although many of them come from the federal government, they all have different requirements, different eligibility, different reporting, different definitions. So it can get quite complicated sometimes, at times, understanding all of the different eligibility requirements. And hopefully we'll give you some tools to help you navigate that. But basically when it comes down to type of rides for consumers, we're really looking at two different types. One is called demand response, which demand response just means that that person needs a ride. It's from their door to wherever they're going and then usually back home again. It's more of a one-on-one type service. That demand response can be delivered in a number of different ways. Some of our providers have very traditional fleets. You'll see the buses with their name on it, and they're taking people to the senior centers and to the doctor, but they're usually 14-passenger or less buses. And then we also have some trips that organizations provide through volunteers, and these volunteers are usually well-trained. They sometimes get mileage reimbursement, sometimes they don't, or a small stipend, but they're mainly volunteers, and they, in our area, mostly provide rides for medical transportation. And then another even more flexible way to provide demand response trips is through vouchers. And that's where the consumer really gets to be in charge in most cases. They can ask a family member or a friend to take them somewhere. Often they can negotiate their own rate for that. They get a certain number of vouchers to use over a period of time, and they arrange the rides to go where they want to go, when they want to go, and with whom they want to provide it. And then that transportation provider turns in the voucher and gets reimbursed that way. And then the other type of ride is what we call fixed or flex route shuttles, and those are usually small buses or shuttles that have a predetermined route that they circulate among. They may start at a senior center and go to the grocery store, and from there to a big hospital medical appointment area, but they have a very fixed route that they continuously provide. When you look at this is just one of our programs, the 5310 program, which Virginia mentioned in the beginning. There's going to be a course on. But when you look at, this is just one of our programs, and the type rides we provide. They're employment, medical, and personal. Personal rides, you can see, are the greatest demand, and those are the ones that are so important to someone's health and overall well-being. They can be to a senior center or a grocery store, really almost anywhere they want to go, to visit a friend. And they're very important because they help people stay active and not isolated and independent in their own home. What most people don't realize is that they're going to outlive their ability to drive by 7 to 10 years. And while people might do a good job of planning for their financial needs as they become older, most people don't think about coming up with a transportation plan. And That's why it's so important that you have options to get people where they need to go. The other just shows a sampling of the type people that we serve. As I said, I think we've all been stating why transportation matters. It is our #1 requested service on our information line. And Atlanta is getting older, but the whole world is getting older. People are living longer, and as I said, the demographics are changing, and with the aging population, it's even more important than ever that you have these options available. And we know that transportation maintains or can improve the quality of life for people. One of the things I want to talk about is one program that we participated in that we actually do believe it made a big difference in people's health outcomes. And that is our community-based care transitions program. This was a pilot program that we did for Centers for Medicare and Medicaid Services. It was funded by Medicare. And it was a program whose goal was to keep people from being readmitted into the hospital. We had 30 days to follow someone and to keep them from being readmitted. We gave them a number of services. It wasn't just transportation. They had a coach that would come out to their home and try to teach them the warning signs for their disease, help them to identify when to call their doctor, help them set some personal goals so that they could stay healthy. But in addition to that coaching on managing their disease, we also thought it was important to give them some support services. And these were the 3 services that we provided: home-delivered meals, homemaker services, and transportation. This slide shows you what we think is a pretty significant increase in results when transportation was provided. For this period of time, we gave the intervention to about 8,400 people. You can see most of the people did not get transportation. That's at 7,937. We know that for the hospitals we work with, when we started the project, their readmission rate was 19.4%. So Medicare has a way to calculate, based on the people we serve, what the readmission rate was that actually received the service. And you can see for all the people that we gave this service to, including the coaching and other services, we reduced the readmission rate from 19.4 to 15%, which is really good. But for the people that opted to get transportation, we even cut it further in half. It went from 19.4 to 7% readmission rate. So while this information is really observational, we didn't do a research design study that teased out transportation and only looked at that. We thought this was significant as a trend or pattern. This slide shows you the actual savings to Medicare as a result of these interventions. Medicare paid us $409.91, as you can see at the top, for every person we saw and gave the intervention to. They calculate that the average cost for the readmission is $10,000. So the amount of readmissions that we avoided by reducing that rate, they could calculate out for us. So for the ones that overall did not get transportation services, it was a $236,000 savings. For the ones that opted for the transportation, even though the number was much, much smaller, you can see the savings was even greater, $389,802. And again, that number is after they have paid us our fee to provide the service. Another big factor that they really emphasize as far as preventing readmissions is that a person visit their physician within 14 days of being discharged from the hospital. That has been found to really increase the success rate that they're not going to go back and be readmitted. We found that we had a 7% increased success rate and that physician follow-up visit, which was great with transportation services. Again, this program was very limited. We offered, during that 30-day period, 2 round-trip medical transportation transportation rides. So it wasn't a lot, and still it had quite a dramatic effect. And as I stated earlier, there's a lot of different programs and services. And in order for consumers or even people who work with consumers, caseworkers and social workers and other folks, caregivers, you've got to have some kind of bridge for the consumer to find out about who you are and what's available. And we at ARC really have 3 different ways that we connect the consumer with transportation and rides. The first one is Aging and Disability Resource Center, and I'm not going to talk about that one. Patty's going to give you a lot of detail about that one, but there's a couple more that I will go over. One is our, well, before I go to that, I'm just going to tell you how we get the word out. We do it, no big surprise, through marketing campaigns. We try to work through community engagement and outreach. There's probably not a health fair or speaking engagement that we don't say yes to. We've got a really well-trained RSVP, Retired Senior Volunteer Program, that these folks are trained on going out and getting the word out about the services, and transportation being one of them. We do offer trainings and forums for professionals and older adults themselves throughout the year. And then one unique thing we had is that for the past year we've been doing a partnership with a local television station where every month they feature a different topic. We go in and we concentrate on that topic, and then throughout the month they do different programs, 30-second spots featuring that. So transportation is one of the things that we've discussed. So getting back to our Simply Get There, that is our website that we have, and a tool that we have to reach consumers that are on the Internet. That's probably the fastest growing way that most people get information. This site is what we call a trip discovery site. It provides all of the options out there for a person to get around within our region. It's specific for the Atlanta region. It looks similar to kayak.com if you've ever done that. And we've got 2 databases that we pulled all of the transportation resources from. Those databases are continuously updated. You can use it on your computer, your tablet, your smartphone. And what's unique about it, what makes it different from Google or Kayak, is that it does include what we call specialized transportation. And I'll go a little bit more into that. It really is just 4 simple steps. This is the home page. Step 1 is you plan your trip. You put in your origin and your destination. Step 2, you're going to select your special services. And this is optional. But if you select that you need specialized services, it's going to ask you 7 questions. It's going to ask you if you're a veteran. It's going to ask your age. It's going to ask if you need a wheelchair, such a vehicle. And things like that might make you eligible, for instance, for Older Americans Act Title III programs, or for special transportation programs that veterans offer. It's just a way to find out if you're eligible, simple screen. And then on step 3, you're going to review all your different travel options are going to come up, and you can choose to window that down based on what you care most about and what matters most to you. It can be I only want to ride trains, no buses. I can't, you can narrow it down by cost. I only want to spend up to a certain amount. The amount of time that you want to spend. It even can tell you how much walking would be involved. So you could say, I can't walk more than a quarter of a mile. And then the last step, after you get all your options, is just to finalize and finish your travel plan, and then you can either print it or save it on your device for next time. We are in the midst of trying to move to the next phase for this website, and what we eventually hope to be able to do with it is to have a centralized eligibility to it. We want to, on our end, be able to triage and send people to the best provider and mode for them. It would be great if we could book and schedule rides on it, and then eventually even pay the different providers through it. This is, as I said, in the early stages of development, but we already know from consumers who use it, one of the number one things they're asking for is to be able to book their trip while on the site. So we hope to get there. And then the last thing that I'm going to talk to you about is travel training, because you can have all of these options available for public transit, which really is your least expensive, most independent way to get around if you can't drive your own car. But if people don't know how to utilize it or they're not comfortable doing it, then it's good to provide some training on how to use public transit. And it teaches folks everything from how to plan a trip and read the schedules. We like to showcase our Simply Get There, but we also have other modes for people who don't use a smartphone. How do you buy a ticket, how to get to your nearby bus and train stops, even how to board and exit the trains and buses. And this training can be provided either in groups or even for folks that need a little bit more attention and time. It can be individualized, where they ride the transit with them until they're comfortable, and that one-on-one training just to get people to that place. With that, I'm going to turn it over to my colleague Patty, who's going to tell you a little bit about our Aging and Disability Resource Center.
Hi everyone, this is Patty, and thank you Eileen for asking me to participate in this webinar. And what I'm going to start with Mary's help here, clicking the next slide, I'm going to get into a little bit more detail, explaining what we do here at the Atlanta ADRC, what services that we provide. The first one is the information and referral system. And that is where the ADRC counselors, which that is me, we provide, along with around 10 other counselors at this point, but we're constantly increasing our staff because of the need. But we provide telephone counseling using the what we call the ESP, and it stands for Enhanced Services Program. It's a very huge, extensive database of more than 26,000 plus services that help link the individuals to the supports and resources they need. We do have an extensive partner network, and we're able to provide the full suite of home and community-based services to older adults and individuals with disabilities. I was giving this number, and it kind of terrified me because I'm on the phones. I had no idea we were getting this many calls, but we receive around 65,000 requests for information per year, and that is for the 10-county Atlanta metro region. So then the next service that is rather new to our services is the Behavioral Health Coaching Initiative. Now that is an extension of the ADRC, and basically what that is doing is it's coordinating the care by bridging the aging services network of home and community-based services with the behavioral health services. So instead of working in silos, we are trying to work together so that we can, make that person address all the person's needs and not individually trying to work one part of the behavioral health, and then they're lacking the community services. So it is a wonderful program that is really, really making a difference in many people's lives. It's helping them to remain in their community. It's helping to stop evictions from the subsidized housing apartments, linking them to, things like home delivered meals and homemaker services. And so we are really seeing great success there. Now, another very, very important part of the services is we are the intake and screening for the long-term services in the home through the Medicaid waiver program called the Community Care Services Program, and we are also the intake for one of the source Medicaid waiver programs. As well as of July 1, we are going to be the intake for the home and community-based services, non-Medicaid services, things like the personal support services, home delivered meals, homemaker, respite, all the services that are offered through the Older Americans Act. Okay, so another service that we do is we do education and resource development, and without this unit we wouldn't be able to operate because they maintain our database, the ESP, and they also reach out to professionals with this education. They provide education about aging and long-term care resources, and it consists of two major work areas. The first is education on the community-based resources and the aging network to providers, professionals, and consumers. And then the resource development part unit manages the ESP, and like I said before, it has 26,000 plus and still growing services in Georgia. So it is the main source of the aging and long-term care provider information for professionals in the state of Georgia. Another service that's offered it's called Community Options Counseling. And what that does is basically, there's only a few of us that have been certified at this point, but there will be many more to come. And it provides a more intensive options counseling, especially those that may be, examples could be if someone is illiterate or they have so many services they need to access. We can't talk about that all on one phone call. So we follow up with printed information to them to make sure what they need to do and then what the counselor is going to do to help them obtain their goal. And lastly, we do, the nursing home transition. And what that entails is basically people that are in nursing homes, if they improve or they want to return back into the community, either to a home environment or maybe to a personal care home, we have counselors that go out and talk to them and provide them with all the options that they have, including maybe getting into the Medicaid waiver program for them to be able to return home. So that's kind of a very quick summary of what we do. Now, the next topic that is really is important for this webinar is about transportation. And so what I thought I might do is, you can see a list of the transportation resources that we have, but I thought I might explain it as if I had just received a call and what I do to tweak out what transportation the person is going to be eligible for. So initially in the conversation, I first determine their age to see if they are a senior 60 plus, that would maybe make them eligible for the Older Americans Act transportation. The challenge there is oftentimes there's waiting lists, but we still encourage people to get on the waiting list because we never know when funding is going to be available and the list is going to be cleared. Then we go into, I would ask, what kind of Social Security are you receiving? If you're receiving SSI, Supplemental Security Income, you're automatically eligible for Medicaid transportation. You would be surprised how people have been on SSI and have not been aware that they have free transportation. And it's really amazing that they could miss this for so long, but then we refer them to the company that can provide the transportation. The next information I would ask is if they were able to walk drive to a bus stop or a station. And if they have a mobility impairment, then I would discuss MARTA public paratransit. And then if they could walk to a bus stop or a station, then I would just give them information on your basic MARTA transportation, which in Atlanta here is the bus and the rail service. But the mobility MARTA paratransit is a wonderful service that really does enable people to get to their doctor appointments. It is $4 each way, which if you have to go really a lot, that can add up, but it is the most reasonable way, to pay for transportation versus a taxi or something. Now, of course, there's a little bit of requirements there where you have to live within a certain distance from the bus stop or the rail in order to qualify. And it also only provides service from 5 a.m. in the morning to 12:30 a.m. So you do reach a little bit of barriers, especially with individuals that I know that I've talked to that are on dialysis. And usually they run two sets of dialysis treatments. You either have to be morning or afternoon. So it can be difficult. Now, if a person lives I would ask them what county they live in. Some counties have very specific bus services, specific routes, as Mary alluded to before. And so if that's a possibility, I would refer them there. Most of the people that I talk to, not all of them, but a lot of them, are living on a very fixed income. So we do, I give them information on transportation vouchers, and that way they can use those vouchers to pay for their MARTA, or use, the vouchers to pay. Sometimes there can be a little bit of a cost share when it comes to county services, but not always. And then, volunteer services, they're very limited, and I think a lot of it has to do with the liability of companies providing that type of service. There's a lot to that with regard to insurance and things like that. And then finally, we get down to, the private pay for the taxis and transportation companies. Usually this is not a good option. It's not affordable. But we do get down to that as the last option, maybe for just a need for one day, to get to that very much needed doctor appointment. So during the course of the conversation, I can tease out what eligibility requirements are needed for whatever referral that I'm going to make. And lastly, for my part, I was just going to give you an example of a call that I had regarding a very, this is not your normal call that I received, but I was so happy that she could get this. So I had a 55-year-old individual, and who's that's young, who is a 2-year stroke patient. And she was so excited when she called me and said that she had enrolled herself in a pilot test program at a hospital to receive free physical therapy for several weeks. So this person had already received your traditional physical therapy. She was young, and this was an opportunity she truly did not want to miss. So I asked her, well, what kind of income do you receive? She received a Social Security disability. But the challenge was that she lived in a very rural county, and she needed to go to a hospital that was in the city. And she told me that, I really could feel for her. She reported that she could drive with one arm because of the stroke. She had weakness in the other arm for a very short distance, but she definitely was not comfortable driving in the city. So this was an unusual type request because she needed transportation for several weeks. So I used the Simply Get There website, and I was able to map out the transportation route. And it was very exciting because she just needed to get to the bus station, which was, I believe she said, about 3 miles away from her. So she didn't feel nervous about driving that distance. And once she got there, she could switch from bus to rail and then that would take her to the hospital. And, the cost was, affordable. She could afford that on her income. And so I was very, very happy to be able, to help her with that. And I think the Simply Get There website is really useful, especially if a person lives in a rural area, because we need to start to get them to where we do have transportation, and oftentimes that may not be specifically in our database on how to do that, but the Simply Get There website is really, really gives that information.
So, thank you, Patty. I just wanted to close out with a ask of all of you that are listening in today, and that's to ask you to please get involved because your voice does matter. As I said, ARC is a metropolitan planning organization, but there's one like us on every inch of this country, and you can use this website to find out, if you don't already know, who your MPO is. And the reason this is so important is because they create the transportation plans with lots of public input and engagement, and every bit of federal funding has to be prioritized. And if it's not in the plan, then we're not allowed to spend funds in the regions that way. So there's also within the transportation plan a human services transportation plan. And that's where all the rides and services for people that have disabilities or low income or seniors are so important that your voice is heard, because the planners need to know what you hear every day, and that's what people really need, where they want to go, how they want to get there. And so I urge you, if you haven't made that connection, so please reach out and provide some input. They'll be delighted to hear from you. And that concludes our presentation. I will turn it back over to Arlene.
Great. Thank you so much, Mary. And I'll leave, we're going to flip to a slide really quick that not only has a list, that same website that you mentioned, Mary, with the MPOs, but an additional list of other resources for folks to identify transportation in their communities. And those include the 211, information on how to find out about your area agency on aging or aging disability resource center, centers for independent living, local public transit agency, and of course the MPO. Now, I know these links aren't clickable through the screen that you all are viewing this on, but you should have received an email with a PowerPoint earlier today, but we'll also be posting this with these links live on our website, and we'll do that shortly in the next couple of days while we're waiting for the recording to get ready. So you can both click on the links and try and find the local resources that are available to you. So we'll leave that screen up while we'll take some questions. We have about 10 minutes left, and we do have a few questions that have come in. So Mary and Patty, I'll let you decide maybe which one of you wants to address these. But we have a question that not everyone is going to have a website like you do, at simplygetthere.com. So before that was launched, where do people find out about this information, and how would you suggest that some folks that maybe are in communities that don't have a website like this find out about what is available?
I mean, before we had to Simply Get There, I mean, basically the ADRC was the intake for all calls for any type of service, including transportation. So it was, this area agency on aging, they would call us, or their county-based service. Their county-based, every county provides county services. So oftentimes they could call there, or they could call us, the ADRC.
Yeah, and even at this time, not everyone uses the internet, so we still rely on our ADRC. And another thing we've done is train other case managers at different agencies on how to link up to the transportation services. So we try to train information workers and case managers throughout the region on what their options are.
Great. So our next question is about prioritizing need for ride. When folks call with medical ride requests versus personal ride requests versus other types, how are those prioritized? And is that something that you, Patty, do yourself, or you make a referral to another transportation provider to do?
Yeah, this is Mary. I'll take a first stab at that. We don't. When I say we directly provide the transportation services, that probably wasn't entirely accurate. We administer those funds. We put out for proposals and bid all of our transportation services, and we probably directly contract with around 20 different organizations that are doing the rides on the ground. And like, for instance, with the Older Americans Act, each program based on their needs and with 5310 will prioritize how they want to spend those funds. Some of them have said they only want to do medical. Others are much more broader. They're doing senior centers and more quality of life type. So depending on where you live, they are prioritizing those funds based on what they put in their proposal. So even it's a little bit more complicated because not every program provides the same type of ride to the same people every time.
Right. I think that probably provides some clarification for the audience. So maybe kind of jumping off of that question a little bit, one of the questions asks you to talk a little bit about your relationship with MARTA, which is your local transit provider, and how that relationship has been built. Right.
We have a very good relationship with MARTA. In fact, we just together put in a joint application for federal funds to expand our travel training. They have a wonderful regional mobility center, and they are very excited to work with us because paratransit, which is the service they provide, is quite expensive in our region. It's almost $50 a one-way trip. And so they are very happy when we train people to ride their fixed route and regular transit services. Another way we support them is they are in the process of assessing and reassessing people for paratransit to determine if people are eligible or capable of riding fixed route if they are given that option with training. So we're supporting that with some 5310 funds that come through our agency. So in the area agency on aging, we work on the human services transportation side with their riders and trying to make sure people know their options. And then in our metropolitan planning organization, they work a lot as transit operators, one to another, and resources and planning around that.
So our next question asks, how do you address any conflict of interest between your options counseling and intake work at the ARC and also offering services like transportation that the counseling may be referring to? But perhaps you answered part of that question in kind of letting us know that you do not provide the direct transportation services.
Right. That's exactly right. We do put all of our services out for proposals and bids, and we do contract out. We have a lot of community partners that are providing those transportation among the other services that Patty talked about.
So we just have a couple more questions. One is just a simple clarification for what OAS and SSBG stands for, and I believe it's on your slide where you have your funding list. You have FTA 53.
SSBG is Social Services Block Grant, and that comes to us through our Department of Human Services, and that's state money that they get for transportation. And then ADA funds are Americans with Disability Act funds. Those are for folks that are in vocational rehab. One thing I didn't get into is that we are administering the coordinated, what we call coordinated transportation for one county. We actually have contracted with a private transportation provider, but that program services, it gets a lot of different federal and state funding streams to serve different populations. And Georgia vocational rehab is one. We serve people with developmental disabilities who are going to work programs and rehab facilities. And then our social services block grant is money that comes down through the state for transportation.
Okay. And then I think maybe the participant mistyped, and they're referring to OAA funds, which is Older Americans.
Yeah, that's our Older Americans Act. Funds primarily for people 60 and older.
Okay. So we just have 5 minutes left, so we'll try and get through the rest of the questions that are coming in. One individual is asking, they have a one-click trip planning website like your Simply Get There, but they don't have the call option like the ADRC. And they're wondering what the funding source is for having the call services.
Our ADRC is funded through a lot of different, like everything we do at ARC, we patch together different funding sources. But Older Americans Act would be one source. We are an intake center for our Medicaid waiver programs. And then there might be some various other smaller grants and programs that support it, but those would probably be our 2 biggest funding sources for that service. And if you don't have the ADRC, you may very well have the ADRC in your area, and I would recommend that you probably your locator, Elder Care locator would be a good place to find out if there is such a call center.
Right, and I think for folks on the webinar, we do have a link to the Elder Care locator website. It's www.eldercare.gov, and the phone number is also listed there. So folks can call that number or go to that website, and our colleagues over at Elder Care Locator can help find the right people in your community to connect with.
And this is Virginia. I just wanted to interject that with the information and referral service, information and referral assistance is a mandated service in the Older Americans Act, so it's generally available in every local community nationwide. But in addition to that, with the ADRCs, they have, in the past certainly, received some Medicaid funding to support their effort, and certainly the building effort of the Aging and Disability Resource Centers. That's a source of funding that I don't know is going to continue, but that's a whole other story.
And let's see, we have one more question coming in. I think maybe it should be our last question. We're almost at time, and it's probably a good one to wrap up this whole discussion. Wondering, do you track how many professionals contact you versus individuals, and what non-transportation type professionals may contact you for referrals or information?
Yes, they are capable of tracking number of calls. Some go through the state, the main 800 number, and then are transferred to us. We also can track the number of professionals that have called us for referrals from hospice, hospitals, referrals from the Medicaid providers. So yes, we have a system called Harmony that we're able to track all of that. We can filter it down to the point of how many calls per day, per month, per year. That's why when I said in the beginning that there were 65,000 calls we received, well, they would be able to divide that up and give, specific information on each type of call.
Great. So we are just at 3 o'clock, and I know there may be some lingering questions that we did not get to answer on the call, and we will definitely try and follow up with you to see if we can work with Patty and Mary to get an answer if it's specific to the ARC information. So again, my information is on the screen at this point. Please feel free to contact me if you have any questions. We will be posting a recording of this webinar to our website, www.nadtc.org. And a big thank you to both Patty and Mary for participating and sharing such great information with us. Thank you.
This concludes today's conference call. You may now disconnect your line. Okay, 1 second. I have you.